Kennedy Jr. is gearing up for his Senate grilling tomorrow. The questioning is sure to focus heavily on all of the drama surrounding the CDC. In June, RFK Jr. fired all 17 members of the CDC's Vaccine Advisory Committee. Just over the past week, we've seen the new CDC director fired after less than a month on the job, and 4 other top officials quit in protest. RFK Jr. then appointed an interim director known for his COVID vaccine skepticism. And today, over 1,000 HHS employees are demanding RFK Jr.'s resignation. RFK Jr. joined President Trump's campaign at a critical time, and many view his supporters and the MAHA movement more generally as critical to the president's victory. After the COVID pandemic, trust in our medical institutions truly plummeted, and rightly so. Things like vaccine mandates, censorship of opposing viewpoints, flip-flopping advisories, needless lockdowns, school closures, and don't forget the cloth masks, made Americans really feel that they couldn't trust the people issuing the guidance. But here's the thing, RFK Jr. isn't just a COVID skeptic. He is a vaccine skeptic who has suggested that vaccines may actually cause autism. Now, in his confirmation fight, he promised Republican senators that those days were behind him and he would not allow his personal views on vaccines to influence public policy. Senator Bill Cassidy, a physician and the man who most see as the deciding vote for Kennedy, said this on the Senate floor.
He has also committed that he had worked within current vaccine approval and safety monitoring systems and not establish parallel systems. It confirmed he will maintain the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices recommendations without changes. CDC will not remove statements on their website pointing out that vaccines do not cause autism.
In the interim, RFK Jr. seems to have reneged on almost every one of those promises. Senator Roger Marshall is also a doctor and one of RFK Jr.'s strongest supporters in the Senate. He's the founder of the Senate MAHA caucus, and he joins us now. Senator Marshall, thank you so much for joining us. You are a person who I know cares deeply and sincerely about the health of every American, and especially rural Americans. So I'm very excited to talk to you about this. Do you not feel that Director Kennedy went back on his word?
You know, I don't. I believe that President Trump chose Bobby Kennedy Jr. because Bobby is a disruptor, that he's trying to turn this healthcare system upside down. Look, 60% of Americans have a chronic disease right now, and that's what we need to be focused on is attacking those diseases. I believe that Secretary Kennedy is doing what he thinks is best. I think he's focusing, again, on how do we interact with those chronic diseases, and I'm standing beside him right now. I'm excited what the future looks like. Remember, the CDC also has a component. It's the Center for Disease Control, but it's also and prevention. The Center for Disease Control and Prevention, and that's what I hope he tells us tomorrow, is how he wants to work with helping to make Americans healthy again by addressing these chronic diseases that are out there.
I agree with everything you just said. Americans are struggling from chronic illness. There are a lot of problems with the food. A lot of the stuff that he is preoccupied with is good stuff. And yet, there also is this question of vaccines. Do you really think that this shakeup at the CDC does not endanger our most vulnerable children, babies, that this is not having a downward spiral and impact on the health of our most vulnerable citizens?
Yeah, I don't. I think the vaccine hesitancy was created by Anthony Fauci. We've lost our faith in the CDC. I mean, how do you explain to a mom and dad, a new mom and dad, that their child's going to get a vaccine, a hepatitis vaccine on day number 1? Your child's going to get 18 jabs in the first 18 months. Your child's going to get 76 jabs before they're old enough to vote. Like many parents out there, and a grandfather myself, I'm concerned about the interaction of those vaccines. I'm concerned about how it impacts the immune system, of developing an immune system of those children. And don't get me wrong, I'm grateful for the vaccines. They have saved millions of lives. I think about the smallpox vaccine and polio vaccine as well. But just speak just for a second about hepatitis vaccines. Every pregnant woman I delivered, I tested her for hepatitis before she delivered. If she was in a stable monogamous relationship, she wasn't doing IV drugs, the risk of that newborn baby having hepatitis is approaching zero. It probably is zero. I wish the CDC would think about a more targeted approach. Who should get the hepatitis vaccine and when? The same thing with COVID vaccines. I think the COVID vaccine recommendations now make sense. If you're over 6 months of age, you can get a vaccine for COVID. You need to talk to your doctor about it, just like you would talk to him about a GLP-1. If you're over the age of 65, you don't even need a doctor's order. They compare that. In the UK, they have the age limit at 75, and in France, 80. So I think that these are new reasonable guidelines. And the reason that Americans don't trust the CDC is because they lied to us about COVID vaccines, and they lied to us again about monkeypox vaccines, of all things.
But what about something like this? The Florida Surgeon General has just mandated an end to all vaccine mandates in Florida, all of them. Let me play this thought for you.
Yeah, I think that...
End all vaccine mandates in Florida law. All of them. All of them. Every last one of them is wrong and drips with disdain and slavery. Okay? Who am I as a government, or anyone else, or who am I as a man standing here now to tell you what you should put in your body?
Isn't this sort of the logical end? I mean, I should first let you respond. I assume you don't agree with that.
Yeah, I think that's a bridge way too far, but I think this is an overreaction because people don't trust what the CDC has been telling them. Let's back up here and just have a little common sense, please. Most importantly, I want you and I want the parents to have a good discussion with the doctor, and then the parents decide. I want the CDC to give them all the information that they need. But as opposed to the hepatitis vaccine, MMR makes perfect sense to me. You don't give it till 1 year of age. The chances of dying from the measles is like 1,000 times more than the chance of a significant side effect from the vaccine. So it's told the test of time. mRNA vaccines, they're brand new. We don't really know a lot of the side effects from them as well. Oh, actually, we do know some of the side effects, especially for young children. So I think a little common sense goes a long ways. I think the CDC should be focused on gold star research and being able to inform doctors and families, parents especially, what the facts truly are, and then let that doctor and the family members make that decision.
Senator, can I ask, do you think that vaccines cause autism?
You know, I don't think that that's been anything out there that would prove that to me. But I'm very willing to do more research on that. I think what's really hard to do with research with these vaccines is trying to understand how they cross-react with each other. You can study one by itself, but when you're doing 76 jabs, how do you understand the interaction? These are medicines. So just like if I give you some Tylenol by itself and I give you some Advil a little bit later in the day, you might have no reaction, but I put them together, maybe you do. So I think it's really hard to tell that. What we do know is that there's an epidemic of chronic diseases in our community. 60% of adults, 20% of our children are on some type of prescription drug. And for some reason, autism, ADHD, all these illnesses are just going through the roof right now. And we really don't know what it is. Why are people getting cancer at a younger age? Why do we have all these peanut allergies? You've got more questions than I have answers. So I think we need to cut, measure twice, cut once when we figure out which vaccines are we going to be given. We need to prioritize. I think 76 jabs is too many. 0 is not the right answer either.
Are there any vaccines that you can say right now every child should get?
Oh, I think the MMR would be on my list right now, and then I want to go through them, one by one, otherwise. But I think most importantly, I would just say I see no reason to give a hepatitis vaccine to that mom who's negative for hepatitis. She's not using IV drugs. No one with hepatitis in the family. I think that we need to really let that baby's immune system develop a little bit. Polio vaccine is I'm absolutely in favor of. Just 110%. I've raised money for polio through the Rotary Club. Proud that there's no polio in America right now. There's only 3 nations in the world with polio as well. That would be another example of a drug that's been around for decades, and by far the benefits outweigh the risk.
Senator, all I can say is I wish you were the head of the CDC instead of RFK Jr. Thank you so much for your thoughtful answers and for your time and for your service.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.